we're now joined by the University of KwaZulu-Natal Infectious Disease Specialist. That's Dr. Richard Lessells. Doctor, thank you for being with us. Should we be worried, is my first question.
No, we shouldn't be worried, and I know that we always say that. People kind of feel that that's our default setting, but really this isn't something to be alarmed about. This is just something indicating that we still have teams working around the country and around the world tracking this virus and tracking how it's changing, how it's evolving. And so these changes that we've seen recently are, again, what we expect to see. So they're not a surprise to us, but we're now just doing the work to characterize these new sublineages, as you say, the BA.4 and BA.5. Yeah. But it's really important to understand that these are all still part of the Omicron variant of concern. They're part of the same family.
Do we know if there's more transmissibility, if they move faster, if there are different symptoms? Do we know anything like that yet?
No, we don't. And as you're familiar from the kind of previous variants and lineages that we detect, that's the work that we're now doing, is to kind of characterize and analyze it and to see has this got different properties from the other lineages, other variants. And so that, as you know, that requires kind of working with the clinical and the epidemiological data, and it requires some of the laboratory work to see how these kind of react to the vaccines and things in the laboratory.
All right, so Doctor, I mean, certainly the numbers still keep going down. It hasn't affected the numbers. You say there's nothing to be concerned about. We weren't sure, but the wish after Omicron first arrived was that new variants might be similar, maybe traveling faster, but they'd be less fatal. So more people may get sick, but less would land up in hospital or die. Are our wishes coming true, or is it too early to tell?
Well, I mean, that's what we saw play out overall in the Omicron wave, and we're seeing even more, that because of the immunity that's built up in the population, unfortunately, from huge numbers of infection, as well as the vaccination, that immunity is protecting many of us from getting very sick with this virus. And that immunity has built up even more in the last few months as many of us got infected with Omicron on top of previous infections and on top of the vaccine. So that kind of wall of immunity protecting ourselves, our communities from getting very sick is quite strong. But one of the things we keep pushing is that can diminish over time, that protection even against severe disease. And that's why it's really important that people do go for their booster dose, or if they haven't had their full primary schedule, make sure they go back for their second dose, so that people are up to date with their vaccination. And again, if this is a reminder of the importance of that, then that may be a good thing, just to remind people that this virus is not going away, and we do need to protect ourselves and those around us as best we can.
All right, so there's still a case for vaccination, and could we still encounter a serious fifth wave? Is that still on the cards?
Well, it may be. I mean, as you know, it's very difficult to predict now what this virus is going to do, and what we're seeing now, as I said, is expected, and we'll analyze it to understand the data. At the moment, and it's always dangerous making these predictions, but at the moment, this doesn't look like a change in the virus that's going to cause a big fifth wave. So we just need to continue watching and tracking this virus. But on your point, yes, vaccination is still the critical thing. This this is a bit of a fallacy, this point that the virus has got weaker and will keep getting weaker. We may see that that's not the case, and that another variant could emerge that has the ability to make people more sick again. So the vaccination is the critical thing. So please go get your first, second, third doses wherever you are, and get yourself protected as well as you can.
All right, thank you for that update. That was University of KwaZulu-Natal Infectious Disease Specialist Dr. Richard Lessells.